long time to realize that there are so many failures when I am doing only this. And then I sat down and I had to think, what should I do now? Really, there is no consistency in results, especially in serious cases where pathological structure is changed, where there is advanced pathological condition. So I attended many seminars. I didn't get the answer anywhere. Everybody was doing the same thing what I was doing, nothing new. So what I did, I sat and started studying my own cases in which I had got very good success, especially serious cases. Cancer case, rheumatoid arthritis case, this type of case, cirrhosis of liver case, where I was able to cure the patient. I studied, and what I found was, in all those cases, the pathology was covered. The pathological process was covered. So now I started attending seminars with that in my mind. And I saw that all those good cases presented, in every case the pathological process was covered, although the teacher was not aware of it. Got it? The teacher would say pathology is not important, and he would prescribe on the mentals and generals like I always did. But it was then I was sure that this is the main thing. So that's when I wrote it. I wrote a book. You know, I think anybody has read my book here?
So,
Who has read? Pathology Factor in Remedy Selection. So I wrote a book with all my cases, saying that this is the importance of pathology, and this is how you have to use the pathological process to cure the patient, to get consistent success. I wrote this book and I sent it to Dr. Rajan Sankaran. And I said, sir, if you like the book, please write a foreword. So he immediately, it's a very small book. He read the book and he wrote to me, I like your book very much. Here is the foreword. I would like to publish your book. That's how he published my book. So whatever I am talking, this is the precursor to that topic actually. Okay? Many cases are from that book, and other cases we'll do in the next 2 sessions. All serious cases. So if you get time, go through the book, see what I have explained in that. And from now on, whichever teacher is teaching or a good result is being shown, you think in these terms. Go and read in your material and you will see that the pathological process is covered. Then it will be your experience. Then you will do it automatically. Okay? So we will do one more case. I'll tell you one more example of the importance of this. So I picked up just before I left my clinic a Xerox copy of a case paper. Just when I was leaving yesterday, one good follow-up came. So I took a copy of that. This tells us how important, how it helps us, the pathological process. This old lady, 73 years old lady, was brought, and she was held by her 2 sons from 2 sides because she couldn't walk straight. She was like falling. She couldn't balance herself. She was swaying. And the main problem was she cannot remember anything. She has become forgetful. It is Alzheimer's disease. She doesn't remember that she has eaten food. So she would eat, and after 10 minutes somebody was, have you eaten? No, she would say. And she would eat again. She doesn't know what she has done 10 minutes back. It was so bad. And when her history was taken, whatever question was asked, the answer was same. I have 8 children, 7 sons and 1 daughter. They are all very well settled. I worked very hard and I brought them up. Same answer to every question. And very smiling, very nicely she was talking. Nobody will say she is sick. But this was her way of answering. She remembered the childhood things. But she doesn't know that she has eaten or no, or what she has done, what she has talked, what she has told. No memory of that. And it seems it started with about 6 months back. There's a temple in some village in Goa, and they take care of that temple. So there was some festival there. So it so happened that a lot of people were there, and suddenly one bull came running towards her. And all people went away. And she was alone there. And a bull came running towards her. So she was so frightened that she passed stools there only. Okay? And fell down. So from that time she has become like this. So this case was taken in detail and some rubrics were taken. Ailments from fright, involuntary stools after fright, whatever. We repertorized, and in the repertorization 2 remedies came up mainly, prominently. One was opium, one was veratrum. And we had to decide between the two. So we open opium and veratrum and see. Wait. I opened opium and I found what? Excretions except skin are checked. This is the pathological process of opium. What happens in opium is for constipation, obstipation, not even flatus passes. All excretions get checked. Except for sweating, skin chhod ke. So this is a pathological process in opium. All excretions checked, stopped. Whereas in veratrum, there is all evacuation, thrown out. Veratrum belongs to Lilliflori family where the main sensation is thrown out. So veratrum is about diarrhea, whereas opium about constipation. No? So the process was different. So I gave veratrum. And the result was very beautiful. In fact, she comes walking alone to the clinic without being held. There is no loss of balance, there is no swaying here and there. And she remembers what she has eaten. She has to be asked, told, but means asked twice. Did you eat food today? What did you eat? She knows she has eaten food. That is all right. But what did you eat today? First she doesn't. Tell me what did you eat today? Third time you ask, she will tell you slowly. Okay, I ate this. So she may even remembers what she has eaten now after asking 3 times, but yes. This is good. Okay. Otherwise I have never seen any Alzheimer's improving. Never ever seen. So this was good. So why I told you this? That what process is going on in the body, you have to see that. That is a genius. Means that remedy produces this sort of pathology. Okay? So now start observing this in every case.